Once again, thanks, Jill, for starting the recording. We're gonna have this available on our YouTube channel so folks can go back and look at the training, share it with your colleagues or others who may find it useful. And then we'll also send a follow-up email with the slides that Caitlin's going to be sharing today. So this is the third of a three-part series that we're doing on how you can use data for falls prevention programming. Today we're going to talk about program evaluation. And our wonderful facilitator for the day is Dr. Kaitlin Piper. She is a assistant professor in the Department of Behavioral Social and Health Education Sciences at the Rollins School of Public Health at Emory, and she is also the associate director of IPRCE, our center. So we're super excited to have her join us today. She is amazing, and I really hope that y'all get to soak up all that she's going to teach us. So, like I mentioned, this is part of a training series that we're putting on as the Georgia Falls Prevention Coalition. For those that are not already a member, please feel free to reach out to me if you'd like to be added to our listserv so that you can stay in the know about what kind of activities we're working on. I'd be happy to get you added. There's over 100 professionals all across Georgia that work with older adults to prevent falls. And we have bi-monthly meetings, bi-monthly trainings. It's a great opportunity to get connected to resources surrounding falls prevention and how you can get active in the falls prevention space in your community. There's also lots of opportunities to collaborate and plenty of program support and connection to subject matter experts. So once again, if you're not already a member, please just send me a message in the chat, or I'll have my email information posted at the end of the presentation as well. Um, so like I mentioned, this is the third of a three-part falls prevention basics training series. Um, Although the data training for falls prevention series, this is the final kind of installment of that. We're still going to continue on with training for falls prevention programming. The next training is going to be in August, and we're going to have the topic's going to be communication. So how do you communicate about your falls prevention program? If you're getting one started in your community, how can you get the word out there and make sure that you're reaching the people that you need to reach? And then in September is Falls Prevention Awareness Month. And there's a specific week, I think it's the second week of September, that's like the actual Falls Prevention Awareness Week. But we, with the help of our task force co-lead Megan from DPH, have collaborated to put on a series of 4 webinars throughout the month of September on Fridays that focus on different topics related to falls prevention. So stay tuned for that as well. Okay, and I think those are all our housekeeping items. If anybody has any questions, feel free to hop off mute. If not, I'll go ahead and hand it over to Kaitlin and we can get started.
Thank you all so much for having me. Let me just get my slides pulled up. I think you all are seeing the correct screen.
Yes,
Yes.
Great.
looks good.
Perfect. Thank you. Um, All right, so I am Dr. Kaitlin Piper. I am an assistant professor at Rollins School of Public Health and associate director of IPRCE. I do a lot of implementation and evaluation type work, and I do a lot of trainings, and I help a lot of organizations with their evaluations. So I'm really excited to be here today to talk about this. And please, if you have any questions throughout, please, raise your hand, interrupt me, put it in the chat. I do want this to be as engaging as possible. So, the first thing I would love for us to do is just to kind of get a feel for who's in the room and kind of what comes to mind when you think of the term evaluation. So, in the chat, if you can please, write a word, a phrase, a sentence, an emoji. um, can you please put in there about, when you hear the word evaluation, what comes to mind? And there are no right and wrong answers to this. Data, yeah. Surveys, testing, observation, measurement. Those are very common things that come to people's mind. Yes. Impact, measure, effectiveness of screenings or interventions. It can be difficult to get the data you need to evaluate falls prevention. Yeah. Okay. Yeah, continue to put things in the chat, but yeah, these are very common words and phrases that kind of come to mind when I do these types of trainings, and a lot of people actually have a lot of anxiety, right, around evaluation and data and surveys, and it can feel really, really overwhelming and difficult to know where to start. But I hope today I can kind of break this down into really simple steps that can help you plan for a program evaluation. So by the end of today, you'll be able to do a few different things, like explain what program evaluation is, identify what you want to learn about your particular program. So this is going to be very an action-oriented type workshop where I really hope that you can leave with like an action plan for next steps for an evaluation. I'll walk you through developing a very simple evaluation plan and then help you identify one thing you can start measuring very soon, maybe even next month. Okay, let me just move the chat over here. Got a lot of things on my screen. Okay, so before we start talking about like, evaluation questions, measures, data, and all the things that you put in the chat. So I want to just take a step back and talk about what program evaluation is. And so at its core, program evaluation is really it's just the process of collecting information to understand how a program is working, whether it's achieving its goals, and how it can be improved. And so when people hear the term evaluation, they often think about complicated statistics, really long reports, something that they have to do for their funders. But evaluation doesn't have to be complicated or stressful. And so I really want you to kind of think about questions that you already have about your program. You know your program better than anyone else. And so I'm sure there's things that are coming up in your mind and questions that you want to know the answer to, like are people attending? Are they benefiting? What are the challenges participants are experiencing? And how can you improve your program? And evaluation is really a structured way to answer those questions using information rather than assumptions. And Again, so there's often this misconception that evaluation is something complicated that only, researchers or evaluation experts do. But I'd really like to suggest that many of you are probably already doing evaluation. You just might not be calling it that. And so I'm sure many of you have asked participants questions like, did you enjoy today's class? What could we have done better today? Would you recommend this program to someone else? So, and if you've asked questions like these, you've already started collecting information about how your program is working and how it can be improved. And that's really as simple as evaluation is. And it doesn't require complicated surveys, statistical analyses, or lengthy reports. Sometimes it starts with simple questions and really genuine curiosity about participants' experiences. And so today we're really going to talk about how to make some of the efforts maybe that you're already doing just a little bit more intentional. Okay, so one of the first questions to ask yourself and your team before starting an evaluation is why are we doing this in the first place? You have to come in with a clear purpose and understanding because I'm sure we've all done, projects and programs before where there wasn't a clear purpose at the beginning and then it becomes really unwieldy. And evaluation is the same way. You really got to start with a clear purpose and a clear understanding with all the team members of why we're doing this evaluation. The purpose matters because it'll shape all the questions that you ask, the data that you collect, and how you use those results. So there isn't one right reason or purpose to evaluate. Different programs have different needs. And so some of the reasons why you might evaluate a program is maybe to understand participation. So maybe you're trying to understand who's enrolling, attending, and completing your program. Like for example, are you reaching the older adults who could benefit most from your services? Are there demographic groups that are being left out? A purpose might be improving program delivery, so it can help you identify what's working well and what could be improved. So you can think about how can I improve my class scheduling? How can I improve location? How can I improve the services that I'm delivering? It can also help you identify barriers. So it can help you identify what's working well, and what could be barriers for participants. So why are some participants dropping out? What challenges are preventing people from enrolling, attending regularly, or implementing the strategies that they've learned from your program? Um, it can also be used to identify or understand participant needs. So it can help you understand what are participants' experiences and needs and what additional support do they want, what information would be helpful for them, and what improvements would make the program more useful or accessible. You might also evaluate to measure outcomes. And I feel like this is where everybody and their brain immediately goes is to measuring outcomes, right? And it's great. And sometimes the goal is to understand whether participants are experiencing the changes that we want them to see. So for falls prevention programs, that might include like increased confidence, greater knowledge of falls prevention strategies, improved balance, or fewer falls. And so when you think of evaluation, a lot of people think of this measuring out those outcomes, but I want you to kind of expand your understanding of evaluation, and it can include all of these other purposes as well. And then, of course, evaluation can support our funding and program sustainability. Being able to show who you served, what participants experienced, how the program really made a difference can strengthen your grant applications, reports, and conversations with partners. And of course, different organizations will prioritize different purposes for their evaluation. Some of you might be most interested in improving your program. Some might be focused on improving participation numbers. Some might be focused on the outcomes or identifying participant barriers. So really identifying what your purpose is before you go into your evaluation is really, really key. And so, one thing I want you to kind of get from this is that evaluations don't usually start with data. They start with a challenge, a question, or a decision that you need to make. So, I want to look here at two hypothetical examples. So, in the first example here, a Matter of Balance program notices that most participants are women over the age of 75. That's their challenge. That's what they're observing currently. So that challenge or observation then leads them to ask, so which demographic groups are enrolling and completing the program, and which groups are underrepresented? And what is preventing those underrepresented groups from engaging? So, um, their purpose isn't necessarily to prove that their program is working. It's really to better understand who they're reaching so they can improve their outreach efforts. And then in the second example, a home safety assessment program has a different challenge. So staff, they provide recommendations, but they don't really know whether the participants are actually making those suggested changes. So this leads them to a different evaluation purpose. And so they really want to understand what proportion of participants are completing their home safety modifications within 30 days and what barriers are preventing completion. So, the purpose they were really focused on is improving their program by identifying the obstacles and developing additional support for the participants. And so, the important takeaway from these examples is that both organizations are evaluating, but for very different reasons. And they start it with an observation or a challenge that they're having to really guide the purpose of their evaluation. And once you have your purpose really honed in on and set, then we can start talking about measurement and data. So we talked about several different reasons organizations evaluate their programs. So now I'd like to think about you to think about your own work. So if you have, limited time and resources, which, we all do, which of these reasons or purposes for program evaluation feels most important for your program right now? So take a moment to think about that. Think about your program and the purpose of your evaluation and choose the reason that feels most important right now, and then put your answer in the chat. And also, if you have any questions, please feel free to raise your hand or come off mute. Okay, I'm seeing a lot of identifying participant barriers, participant needs, um, participation and attendance. We want to be really meta about it, Mia. Yes, for training evaluations like this, see if the participants actually use the info they learned in the training. Yes. Okay, great. And there's a couple in here looking at outcomes. Would anybody like to share why they selected this purpose for their particular program? Maybe we can have like one or two share
This is
why they.
Venus.
Yeah,
With,
please.
hi, this is Venus with Melba's Heart Charitable Foundation. And I chose outcomes. Mainly because we are fairly new. Our organization is only 2 years old, and the fall prevention is our flagship program. So it's very important, I feel, that we're able to find out what the outcomes are if the participants based on our programs are falling less.
Yeah.
um, and there's certainly definitely room for all the other reasons as well, and I can see a need for evaluations in those too, but for us, outcomes just kind of stand out, at least at this point, with what we're doing.
Yeah, that makes a ton of sense, especially you want to show that your program is working and that it's delivering those outcomes that you think it is. Because if it's not, then you might have to kind of understand, okay, then why aren't we seeing the outcomes that we want to see? So I think that's a great place to start. Would anybody else like to share? Any brave souls? Okay, okay. All right. Okay, so now we all have our purpose. So remember your purpose because you will need your purpose for other parts of this presentation. So like I was talking about, your evaluation purpose shapes your evaluation questions. And I know there's a lot of writing on the slide, but so don't worry about reading everything. But different evaluation questions, they naturally lead to different evaluation purposes naturally lead to different evaluation questions. So if your goal is to understand participation, you're going to be asking questions about attendance and completion of the program. If your goal is to identify barriers, you're going to be asking questions about why. Why aren't they enrolling? Why aren't they attending? If your goal is to measure outcomes, you're going to be asking questions about changes in confidence, behavior change, falls prevention outcomes. So the key takeaway here is that your evaluation purpose should guide the different types of questions that you ask. And I've provided some examples on the screen here. And of course, you're going to get these slides to take with you as well. So not all evaluation questions are equally useful. So strong evaluation questions tend to have three things in common. So first, they're specific. They clearly define what you're trying to learn. So you want your evaluation question to define is the data coming from? Who are we evaluating? What are we evaluating and when? Also, what is the time frame for that measurement? So you want them to be very specific. So instead of asking something like, did our program work? We might ask, what percentage of participants completed at least 6 of the 8 sessions? So you want it to be, it's defined by who, the participants, the what is the completion, and when. So 6 of 8 sessions. So it's kind of time bound. So you want your questions to be specific like that. Second, you want them to be practical. So the questions should be answerable with the resources that you actually have. Most of us don't have unlimited time, staff, or funding, so it's really important to choose questions that are realistic to answer. And then finally, the questions are actionable. The answers should help you actually make a decision. If you learn that the participants are dropping out because of transportation challenges, this is information that you can then use to improve the program later down the line. So really think about, are my evaluation questions specific, practical, and actionable? Okay, and then have some examples of good versus better evaluation questions. And so notice that the questions on the left aren't necessarily bad. They're often where we start, but they're difficult to answer because they're broad and really open to interpretation. And so the questions on the right are typically more useful because they're specific, they clearly define what we're trying to learn, and can be linked to a measure and a specific data source. So let's look at a couple of examples on this slide. So a lot of organizations kind of start with a question like, did our program work? And that's completely reasonable place to start. But it's hard to answer because work can mean different things to different people. Instead, we might ask, do participants report increased confidence in preventing falls after completing the program compared to before enrollment? It's a lot more specific. And so now we know exactly what we're measuring. We're measuring confidence and who we're measuring it for and what time we're comparing it to before and after the program. So the same thing with attendance, rather than asking, are people attending? We can ask, what percentage of participants attended at least 6 of the 8 program sessions? This gives us a much more specific and clear metric that we can track over time. Another common question is, so did they like the program? Did the participants like it? Instead, we could ask what percentage of participants report being satisfied or very satisfied with the program, and what aspects do they find most helpful? So, for this question, it's not just whether the participants were satisfied, but also what they actually valued most. And this gives us information that we can use to improve the program. And so you can notice that all of the questions on the right tell us exactly what information we need to collect. They're specific, practical, and importantly, the answers can help us make actionable decisions. You want your evaluation to actually lead to something or lead to some kind of change. All right, now it's your turn again. So I want you to think about your own program and the evaluation purpose you identified earlier. So go back to your purpose and then think about what is one evaluation question you really liked answers that you what is one evaluation question that you'd like answered that relates to your evaluation purpose? So don't worry too much about getting your evaluation wording perfect. Just focus on identifying one question that would help you learn something useful about your program and it links back to your purpose. So take a few minutes to think about that, and then when you're ready, put your evaluation question in the chat. Okay, we have some really great ones coming through. I see, how confident are you that you can use at least one of the strategies discussed today to reduce falls? Perfect. We know what we're measuring. We're measuring confidence, at least one. That's very specific. And today it's time bound. Very, very good. What percentage of participants completed the final follow-up? That'll be a really interesting question. And yes, very specific too. Great. What percentage of participants report feeling less scared of falling after the program? Perfect. Um, how many participants prefer a regular versus flexible schedule for a program? Really interesting. Yeah, that's a great question. Since the program ended, have you experienced a fall? Great. What does a successful outcome look like for you personally at the end of this training? I love that because it's a very qualitative, open-ended question that gives them space to provide the answer. I love that. These are great. Awesome. Really, really nice work. These are all very practical, specific, and I can see they could lead to specific actions for your program. Okay. Okay, so once you have a really strong evaluation question, the next step is figuring out how you're actually going to answer that evaluation question. So every evaluation kind of follows the same kind of basic process. So first you identify your evaluation purpose. We already did that. Identify the evaluation question you want to answer. Check. Then you decide what you need to measure it and then identify where that information is going to come from. So let's look at a couple of examples um, on this slide. So suppose your question is, what percentage of participants attend at least 6 of the 8 sessions? To answer that question, we need a measure. In this case, it's the completion rate. And then we need a data source. So where would that information come from? Probably in this case, it will come from some kind of attendance records like a sign-in sheet. So let's look at another example. So maybe your question is, do participants report increased confidence after the program? So we can't directly observe confidence, so we need a way to measure it. So we might ask participants to rate their confidence on a scale of 1 to 5 before and after the program. And we can see, did their confidence increase from before to after the program? So the measure is the confidence rating, and then the data source is a pre and post program survey. I'll do one more example here. And so maybe we're also interested in whether participants are making home safety changes. So our question might be, what proportion of participants complete at least one recommended home safety modification within 30 days? So the measure is percentage completing the modification. And then the data source might be maybe you do a follow-up phone call with them to ask them about what modifications they made. So notice that the question really determines what we measure, and then the measure determines what data we need to collect it. And so one of the most common mistakes that organizations make is collecting data first and then trying to figure out how to use it. So evaluation really works best when you start with the purpose, then with the question, and then work forward to your data. And so once you've identified your evaluation question, then you're going to choose a measure. And this is when a lot of organizations start to kind of overcomplicate things. They think, you need a sophisticated survey, a validated assessment, or some complicated data collection system. In reality, a good measure is often something simple and easy to collect. So again, first key characteristics is that your measure should be something easy and feasible to collect. If collecting the data requires more time or resources than you have available, it's probably not the right measure. So if you're interested in attendance, you probably don't need a new survey, a sign-in sheet, maybe all that you need. Second, it should be relevant. The measure should directly connect to the question you're trying to answer. Third, it should be understandable. If you share the results with staff, participants, board members, or funders, they should be able to easily understand what the measure means. And then finally, a good measure should be useful for decision making. So the goal of program evaluation isn't just to collect the data, it's to learn something that helps you improve your program and better serve the participants. So for instance, you might learn that, 40% of participants drop out before completing the program. And that gives you great information to act on, but also knowing why they drop out can be even more useful. And again, one of the bottom lines of this whole presentation is that it doesn't need to be perfect or complicated. Oftentimes, simple is best. And when many people hear the word evaluation, they immediately think about surveys, right? We all like think about surveys immediately. And surveys can be great and they can be useful and they for sure serve a purpose. But evaluation data can come from many different places, and often the best place to start is with the information that you're already collecting. And I'm sure all of you are already collecting different types of information. So, for instance, if you're interested in participation, you may already have sign-in sheets, registration forms, attendance records that can answer that question. If you're conducting home safety assessments, you might already have home visit records, case notes, referral logs, other kinds of follow-up documentation that can provide useful information. And not all evaluation data needs to come from paperwork or something that's written down. Sometimes a brief conversation with a participant, like when they're leaving the program, like, hey, what went well today? What could we have done better? What were some barriers for you? So sometimes just having that real brief conversation provides you with a lot of great informative data that you can use. Additionally, observations can be great. Comments collected through feedback forms can also provide valuable insights into what is working or could be improved. And as we talked about, evaluation data can come from a lot of different sources, and some of that information is numerical, and some of it comes from people's experiences and stories. And both the numbers and the stories are valuable, and often they work best when you combine them together. So on the left are examples of what we call quantitative data or numerical or number data. And these tell us what happened. So, for instance, how many people attended, what percentage completed the program, how many falls were reported, how many home safety modifications were completed. And so these measures help us understand the size and the scope of an outcome, but the numbers don't always tell the full story. And that's really where the qualitative data can come in and help. And so things like participant feedback, interviews, comments, observation can help us understand the why something happened. Like our attendance records might tell us that 60% of participants completed the program, but that doesn't tell us why the 40% didn't finish. And so maybe talking with those 40% and with follow-up conversations might reveal the reasons why they didn't finish and what the barriers were for them to complete. And that's the kind of information that can help us improve the program. And oftentimes, really strong evaluations combine both the numbers and the stories. All right, so now let's try to put everything that we learned kind of together into one package. So up until this point, we talked about the evaluation purpose, how to write a strong evaluation question, and how to identify measures and where the data can come from. So now I'd like you to apply that process from start to finish. So think about your evaluation question you developed earlier, then ask yourself, what would I need to measure to answer that question? Where would that information come from? And do I already have that information or would I need to start collecting it? So I'll give you a few minutes to think through these questions and then kind of note them down in the chat when you're ready.
Can you repeat the assignment?
Of course, yes. So I want you to think about, so you already have your purpose, you have your evaluation question. So I'd like you to restate your evaluation question and then state how you would measure, what you would measure to answer it, and then what data source you would use. And is this information already available, um, or would you need more data to collect it? And the example on kind of the right-hand side of the screen kind of provides the kind of scaffolding for answering.
Thank you.
Hmm.
Is there a name for like a formal name for descriptive measure, like not just 1 to 5 or ABCD, but like actual phrases, like not at all, a little, somewhat, very.
Yeah, for sure. So I think when you have like a scale of 1 to 5, you can label the one as, never has this happened. The 5 could be always this happened. And so you can label those with those phrases in the way that kind of makes sense for your question. Like,
Oh,
yes, a Likert scale. Yeah.
okay. Thank you.
Okay, so the ones I'm seeing in the chat look really, really great. Um, does anybody have any challenges or questions about data sources that they can use to answer their evaluation questions? So I know sometimes that can be the tricky piece.
I'm wondering, Caitlin, for some of our mini grantees, so folks that received some funds to put on a falls prevention program in their community, some folks did they participated in like a health fair and had some like a table with falls prevention resources. Um, and I'm wondering, like in that setting of like a health fair where people are kind of like passing through, they're not necessarily participating in a formal training, and they might not necessarily be there like specifically for your falls prevention stuff. Like it's kind of challenging to catch people, I guess, when they're even if you
Mhm.
do if they stop at your table and you do, say you're doing like demonstrations on how to do a fall risk assessment, for example. Um, that's something that um that could be, it's like a couple minute interaction as opposed to like an hour long training or so if I don't know that's kind of like a challenging setting I feel like sometimes for folks when it comes to evaluation.
Yeah, that's a great question. So I think there's things that you can track if you're diligent during the health fair. So you can count like how many flyers people took. So if you know like how many flyers are in your stack, then you can kind of know how many you've given out or how many materials people have taken. That's kind of a measure of how many people you've reached. You can also count like the number of demonstrations that you did. So you can like just even like a simple tally each time that you did a demonstration for someone or a group. You can just kind of like tally that down. Um, you can also think about like having people, maybe sign up for a listserv. So like the number of people that maybe like signed up on your sign up sheet that you've added to your listserv or newsletter, or maybe number of new people that you've enrolled in your program. So a lot of it is honestly just counting, and being diligent about making sure you're tallying those counts. Venus, I see your hand.
Yeah, and thanks for bringing that up because I'm sorry I didn't see the who brought it up, but thanks for bringing it up. We did three health fairs this spring, and one of the things that is true that it can be a struggle, but something that I've figured out after the fact is that maybe when you're signing up for the event itself, maybe to communicate with the organizers to sort of piggyback on, they usually do some type of survey themselves. So maybe that's an idea to sort of collaborate with the organizer in general. Um, and maybe some information could be gleaned from that because if they are sending out, a general survey for the event in its entirety, maybe some of that can be geared toward, what you're doing specifically.
That's an amazing point. Thank you for sharing that.
Sure.
Any other questions or thoughts about data sources and collecting information?
What about electronic type stuff? Like if there's a situation where there's a QR code or there's something that they can do like it kind of immediately so that they can get the information like, maybe like right when it's going on or at your booth or whatever, but just like a electronic way of doing a quick survey.
Yeah, for sure. I think having a QR code at your booth could be great. Maybe it links to your website and then you can count like the number of times somebody used that QR code to go to your website, or maybe the QR code is a little brief survey that they fill out and you can get some information. So that's a lovely idea. Okay, perfect. If anything else comes up, please raise your hand or come off mute. Okay, so if this is one of your first evaluations or if you're new to evaluation, I think it's just really important to keep it simple. So think about 1 to 2 questions that matter to you most right now, 1 to 2 measures, and then only collect data that you're actually going to be using to make decisions. And some common mistakes to avoid when you're doing evaluation, and these are things that I see a lot of people do, and it's very common. So the first one is trying to measure too much. And so Some organizations try to answer every possible question at once, and the result is often a lot of work and not usable information. The second mistake that I see a lot is collecting data just for the sake of collecting data. So make sure everything that you're collecting, it has a purpose and is going to lend to some kind of action. A third mistake is kind of waiting for the perfect data or the perfect evaluation to kind of come along. So some people are like, yeah, we don't have the right survey, we don't have the data system, we maybe we'll start next year, but it doesn't have to be perfect to be useful. So something simple that we've been talking about is, far better than doing nothing. And then finally, some people forget to share their findings. So it's not about just getting the data, but also using it. So it's important to share your findings with your team, with the participants, with your funders, with other people who are in the falls prevention space so that you can kind of collaborate and understanding what, is working for all of you and what everybody can kind of be doing better. Oops. And also sharing your results doesn't need to be fancy. Sometimes it can just be like a one pager in something that's really easy for other people to learn about your program and what's working. Yeah, you don't need kind of a long report or any fancy charts most of the time. Sometimes a few simple numbers and participant quotes that show their experience are sometimes enough. So for instance, you might share, we had 85 participants enrolled over the course of the session, 78 complete the program, 92% reported greater confidence in preventing falls, and then you might incorporate some participant quotes that also share their experience, like maybe someone says, I feel much safer walking outside now. So it's great to kind of pick out the pieces that show your impact and also incorporate some quotes to show the participant experience is really nice. And you should also be using your results to drive decisions. So you might want to think about using your data to look at things. What should we keep doing? What should we change? What should we stop doing? What are things that we should be investing in? And evaluation is most valuable when it helps you answer these kinds of practical questions and improve your program over time. So I'm going to pull together kind of everything that we talked about in the workshop today and walk through just a couple of examples so you can see kind of what an evaluation plan can look like start to finish. So this is just a hypothetical case example. So think about imagine a Tai Chi program. They notice that their attendance starts dropping off after the first few classes. That's the challenge that they've observed. So then they ask what barriers are preventing participants from attending at least 8 of the 10 classes. And to answer that question, they conduct brief follow-up phone calls with participants who missed classes. And the findings are pretty straightforward. Participants mention challenges like transportation, concerns about bad weather, and conflicts with the class time. So now the organization really has information that they can act on. They might move the classes to a more central location, add an afternoon session, and begin sending reminder calls before each class. And after making those changes, they were able to increase that completion rate that they were measuring. And so this is an example of how an evaluation can be used for improvement and kind of improve the participation, which was their kind of purpose and goal in the first place. And then one more hypothetical case example that I'll show. So in this case, a home safety assessment program was making recommendations to participants, things like, installing grab bars, improving lighting, removing tripping hazards. And so the staff felt like the recommendations were valuable, but they weren't sure whether the participants were actually making the suggested changes once the visit was over. So that's the challenge that they observed, and they decided to evaluate it. So their question was, what proportion of participants complete at least one recommended home safety modification within 30 days? To answer that question, they conducted some simple follow-up phone calls about a month after the home visit. And the results really gave them a lot of information. So they found that only about 40% of participants had completed a recommendation. Um, and they also asked them why they didn't. So they reported barriers like cost, not knowing where to purchase supplies, and difficulty installing things. So because they collected this information, they could then take action, create resource guides, information on financial assistance, and resources for those home modifications. And after making those changes, then they were able to see an increase in the completion rate. So this is an example of how um, just observing a challenge that you're facing can lead to action and improvement in your program. All right, so now you have the building blocks for an evaluation plan. You have your purpose, one evaluation question, one measure, and one data source. So I'd love for you to put in the chat what is one next step you will take related to evaluation in the next month. Writing up the findings. It could even be as simple as talking to your team and setting a purpose. Set up evaluation participation at the beginning of the program. Great. Okay, Adam says methodology adjustments. We've implemented the FES when short and pre-post surveys, but compliance on the post is terrible. We expect in-person paper and pencil is more effective for the post survey. That's great. Yeah, getting people to complete the survey when you see them in person, because once they leave, it's going to be really hard to catch them. Okay, these are great. Continue to put those in there. I'd love for you to have like an action plan for when you leave, or an action item at least. Okay, some key takeaways. Starting small is great. One question, one measure, one data source. That's a complete plan. So you can always just start there. Use what you have. You're probably already collecting data, or you can collect data in really simple ways. It doesn't have to be complicated. Focus on your decision making, collect information that helps you act, and think about progress over perfection. So simple, consistent evaluation beats something that's really, really big, complicated, and difficult to implement. All right, well, that is all I have. I want to thank you for your attention and for coming to this presentation. I am more than happy to take questions or and open up the room for discussion. And I appreciate you all participating in the chats and going through those reflection exercises throughout the presentation.
Awesome. Thank you so much, Kaitlin. That was great. I'm gonna go ahead and put our conclusion slide up on the screen. Um, so again, thank you, Kaitlin, and thanks to you all for attending. We again, we'll have a follow-up email sent out, and it'll include a link to the evaluation survey, which, if you all don't mind, you can scan this QR code and just quickly complete it now, or you'll also be able to access it through the follow-up email. We'll also include in there a note to if you would like to join the coalition and you're not already a member, you can email me and we'll get you added to our listserv. And then we just ask that y'all stay tuned for the upcoming trainings that we have in August and September.
And Caitlin, we do have a question in the chat for you.
Okay. Venus says, how do we get help interpreting data that we've previously collected? I think that's a great question. Mia, Jill, I'm not sure. Um,
Venus, we actually, this is something we can talk about in a little bit. I think we're going to meet later today. And that's something I was going to mention is we can definitely support in the data or looking at the data that you already have.
Okay, thanks.
Yeah, thank you.
And then we have a question from Deborah. What is the difference between program evaluation and examining the feasibility, acceptability of a randomized control trial, or is it the same? I would argue that they're different. Program evaluation is typically evaluating something that's already ongoing and is regularly being delivered. A randomized control trial, this is something typically, it's an experimental research design, and so that's very different than evaluating something that is ongoing. With an experimental design, you're actually, um, you know, randomizing people to either receive the intervention or not receive the intervention. And so that would be more considered research than program evaluation. So there's some nuance there. But typically in program evaluation, we're not randomizing, we're not like doing experimental designs. We're more collecting data on something that's ongoing. Great question. Anything else that I can help with?
If anybody, if folks think of questions after we've already logged off for the day, Caitlin, I'll also include your email if that's okay in the follow-up email that we send out. You can always reach out to us directly if questions come up. All right. I think with that, Jill, is there anything that you wanted to add?